Hello, my name is Michael Riley. It's Christmas Day, 2025. Merry Christmas. This is regarding something that I've been thinking about for a long time, and really I think it needs to be spoken to all the doctors out there and all the patients, all of us people out here would go to doctors, and that's everybody. There's a problem between the communication between, it's not just communication, but the interaction between patients and doctors that I think really needs to be addressed and talked about to make it more understandable why there's such a difficult, more of a difficult situation in interaction with doctors and patients than there needs to be. First of all, the thing that comes to mind is doctors aren't God. That's true. One of the things that bothers me, really, and always has, and just confused me, as you get to know me more, you'll understand why. I'm a person that's very literal. Very literal. I mean, it's problematic on my part. But it's not, because so many things are racing through my mind right now. One of the things I had to fight with when I was younger was, because of the literal tendency, is to be not so much a perfectionist. You know, most people don't really care, if it's exactly right or whatever. Well, that's just not me. It's my degree in college, Arizona State, was something I didn't really want to do. My grandfather talked me into it, but along with my ROTC officer training at Arizona State, was electrical engineering, and what I started with was psychology. I did that for 2 years, and then I switched over to electrical engineering, and I failed calculus twice. Why? Not because I'm stupid, because I was trying to prove the theorems that are already proven. This is just how my mind works, and it has since I was born. I've got to get down to the nitty-gritty of exactly why something's the way it is. And like I say, it's created. When I was younger, it was like everything had to be perfect. And I'm talking everything, talking to somebody, the way somebody says, whatever. I mean, it's very critical on my part. And and plus very challenging on my part towards myself, in that if I wasn't doing something perfectly, I wasn't doing it right. Most people are not that way. Most people, oh, that's good enough. You hear that all the time. To me, it's not. No, it has to be, in my business, in heating, air, appliance repair, manufacturing of refrigeration products that I do. Look at the Challenger. They didn't get it right. How many people they kill? And they should never have gone up, and they knew that. That's what I'm talking about. It's got to be right. I mean, look at this Tesla garbage. This idiot is endangering everybody on the road with this Tesla car. It's insane. And now they're after him legally about how he describes it as a self-driving car and auto. No, it's not. So that's a whole nother subject, but the point is there that he doesn't care about safety. Look at the guy that imploded the sub. I mean, unbelievable. He just ignored safety. The NTSB they don't care about safety anymore. They just don't. They're allowing this garbage that is not proven and is dangerous on the roads. Go back to the doctors. One of the biggest problems, and I think I've finally come to a way to really bring this out, it's really important, is it's my own experience with so many doctors, who, especially in the last 5 years, that I've almost died 3 or 4 times. My health has always been just fine. No concerns my whole life. I get injured, I heal up just like, miraculously. Next day, it's like never happened. But I had an infection in my tooth. Right now, you can probably tell that it's a little difficult for me to talk. It's because of that. And they're not put in there properly. The bottom one's not put in properly. I had to have all my teeth pulled out. I had a brain bleed and an accident and just settled the lawsuit where it cracked my nasal cavity, and this got infected up here. I ended up with sepsis 2 years ago. For about 3 years prior to that, every doctor I was going to was telling me, or they would do labs, and the labs would come back, and the one that I would notice the most was the white blood cell count was just through the roof. And I go, don't worry about it. Don't worry about it. I'm thinking, don't worry about it. What do you mean? All my life I've heard about white, blood cell. There's an infection. But these doctors are just like with my heart. I couldn't hardly walk for 10 years, 10 feet. And they're like, don't worry about it. I even had one cardiologist set me up for the treadmill stress test, and he canceled it. And I said, why did you cancel I don't understand. I've been telling you that for a year that I can't hardly walk. I mean, I don't understand these doctors. When I would go to the emergency room, they kept saying something about heart markers. We're the patient. We don't know what all those things mean. We just don't know, but they kept bringing it up, and common sense tells me if they're bringing something up, markers or something, something's going on, or you wouldn't have those. That's the way my mind thinks. But that information, the reports, my cardiologist is supposed to be looking at. Problem is, the last 5 years, I've noticed more than anything, just like with the white blood cell count being through the roof, all my doctors were not paying attention to it. They have too many patients, for one. We all go to the not just the emergency room, but in this case, I'm talking about to an appointment. How long do you sit there and wait? Because they're overbooked. They can't keep track of all those patients. Records from emergency visit. I mean, they would have no life at all they'd have to have a computer do it. Because there's no hours in a day for them to go through all the records and actions towards all their patients in emergency rooms, in other care that they got before the appointment again, because appointments take, usually it's another month before you go to your doctor again. So these heart markers, I even mentioned it to my cardiologist. They said, they keep saying something in the emergency room about heart markers. And he was not aware of it. I said, don't you have access to those records? And he said, yeah. Just flippantly almost. Not really flippantly, but just like it was no big deal that he didn't see them. It is a big deal. I've been telling you. See? He's got no idea. So he goes and checks him out, and then he reschedules the stress test. I didn't make it through it. I about collapsed. And they were really concerned. I was in for a double bypass in just like a week. Because my heart arteries were plugged. I mean, I'm going to have another heart attack. The first heart attack I had was because they were ignoring my horrible pain in my chest. And I went to 10 different doctors, and they all, you wouldn't have that much pain if it was your heart. And they let me have a heart attack. This is what we're dealing with, people. And I don't understand it. I don't think they're doing it on purpose. But I don't understand it. If I'm fixing an air conditioner and this lady's got life-threatening health and she needs her air conditioner fixed so she won't die in a hot house, it's my responsibility to make sure I do my job right so I don't kill this lady. These doctors, they just don't act like they care. And if you say anything, because they're so busy, we all know that when they come in, they're like 30 seconds, they want to get out of there and go to the next room. Because it's like a puppy mill. They're just trying to get all these patients out so they get that small amount of insurance money added up for all the patients so they can make money that day. They don't care about spending time with you. They honestly don't. They get upset and irritated if they have to stop and start talking and answer your questions. A lot of these doctors that I've had. And I'll change doctors. I have my insurance company say, you can't keep changing. I said, yes, I am going to keep changing. And don't let the insurance company tell you that. If you have a doctor, I had one that did plant therapy. She didn't believe in medicine. And she kept telling me her book, she wrote a book about plant health. That's how you get better. Are you kidding me? I was gone from her and nothing flat. I don't understand how these people get these doctors get these. But going back to what I was going to started to say earlier was a word that's always bothered me was the word practice. They call it doctors what they do a practice. I'm sorry, I'm literal. I don't want anybody practicing on me. I went to the emergency room once. They thought I was having a heart attack. This was 20 years ago or so. And I looked at the emergency room doctor and I said, if you're new at this or you're an intern and you're learning, you need to step away from me and get somebody that's been doing this and knows what they're doing. He said, no, relax. Yeah, I've been doing this 30 years. I'm not new at this. You're in good hands. Say that, people. I had a colostomy, or not a colostomy, the one where everybody hates. I'll think of it in a second here, but it's to check your your intestines and everything, and colonoscopy. And they came in, the anesthesiologist came in. It wasn't the anesthesiologist. Well, it was him, and then there was somebody else with him. And he said, he's going to be doing, he's learning, and he's learning. You don't need to say anything more. I stopped him. I said, look, I understand and I appreciate that he has to learn his job, but I prefer that you don't do that on me, because if there's a mistake, I don't want to be the result of that mistake. I'm sorry, it's no offense towards you. I was very nice to the guy. And the kid, the younger guy, he was in there. The anesthesiologist left. He was irritated. Probably had something else he wanted to do, and that's why this guy was going to do it. I don't care what you got to do. I don't care. I want the best care possible. And I don't want to be a result of a mistake by somebody learning. That's just not going to happen. A better chance of that happening if somebody's learning. Oh, I thought you were supposed to do this. Yeah, well, he's dead now, so it doesn't matter. Are you kidding? We have one life to live. It's not like you can reset the button on a video game. You're not practicing on me. That word really bothers me in what they call doctors' offices, a practice. And I had doctors defend it. Yeah, because they're always learning. Well, what'd you go to medical school for? Are you kidding? Okay, that would be going back to the God complex. No, they're not God. They don't know everything. So we have to understand that. In my business, I run into things that have never happened before, I've never seen. You got to learn from it. But that's the problem with human bodies. Learning from it, they can end up dead. Especially with something like sepsis or something. You know? Give them the wrong medicine and they're dead. Because seconds count. Or a heart attack. So one of the things that I've thought about this for many years. The challenge is talking to the doctor. I have a vascular surgeon right now that when I first saw him, I'm very strong about, I try to do it gently, I take pseudoephedrine. Pseudoephedrine is Sudafed. It's asthma. People with asthma take it because it opens up your bronchioles. And doctors don't like it, I found out. They think it all. One of the things that they state in the pharmaceutical description of the drug is that it can cause increased blood pressure. Here I am literal again. You got to be literal. Because it says it can, doesn't mean it does. Every body is different. Some bodies are allergic to certain drugs, some bodies aren't. So every body is different. In my case, I even did a month-long study of it with my blood pressure and logged it for the doctor several years ago, 10 years or so ago, because I kept having to argue with these doctors about, no, when I take it, my blood pressure goes down because I can breathe and I'm not stressed. And when I can't breathe, my body panics and my blood pressure goes up. I had to prove this to every doctor a new doctor I have. My heart surgeon, I told him, I said, I have to take it. Please don't say no because I panic if I can't breathe. My twin brother died at birth from asthma and they brought him back, but he struggled his whole life. That's my twin. And I was in the same egg. I've got the same thing, but it wasn't as detrimental for me, apparently. But it's coming up a little bit later in life. So I tell them that, like, I had I took my open heart surgery, and I said, I have to take it. Please don't say no. It drops my blood pressure. It's not going to affect my blood pressure. I promise you. And when you tell them what I just said a second ago, they understand. When I can breathe, I don't panic. When somebody's body panics, our blood pressure goes way up. It's just like if there's an accident or something, we get your blood pressure goes up. It goes up quick when you panic, especially when your body panics. And when I can't breathe, my blood pressure, it's been 120 over 110 before. I mean, so just like with pain, it will go up with pain as well. So, you know your body is what I'm really going to, in the end here, get to. That matters with the doctors. You have to let these doctors know your body is different than somebody else's or the general norm. You have to tell them how your body reacts. They don't know you. They just started working with you. So they're going to start from the beginning and go through the whole regimen. I had this with a gastroenterologist. I've done about 25 gastros over the 40 plus years that I've had horrible problems with my stomach. And they don't listen. They start from the beginning, like they have a sheet of things with a new patient, what it could possibly be. If they would listen to you, but that's where it's on you patients, but also on you doctors. You need to listen to the patient. I know you want to race out of that room and go on to the next one so you can get all those submitted, all those patients' billings submitted, so you can make money for the day, but we're not going to let you do that. Our health is more important than your billing. I don't care about your billing. I honestly don't. I care about my life, and you should too. And too many act like they don't. The doctors need to listen to us. Stop at the beginning of your procedure like you would with every new patient. Stop. And do a history. You have our history. You know what the irritating thing, and everybody runs into this, they get your history, now they're forcing you to put your history in before fill out the forms before you go to the office to save you time. I don't do it. Because it's a waste of time. Why? This is hilarious. This is stupid too. It's irritating, is what it is. You fill it out then you go in, the PA comes in, nurse assistant, they take in first. She's asking you all these questions that you just answered on the damn forms. And I'm sure you've said before, I filled out the forms and I put all that down. Yeah, we ask it again. Then the doctor comes in. Does he look at the form or what the nurse assistant? Nope. He asks you the same things. This is unbelievable. A total waste of time. Doctors. You wouldn't be so behind in your appointments if you would take the forms that we fill out. Look at them. Stop wasting your time asking the same damn questions over and over and over, and listen to us about what's wrong with us. You should already have that history looked at. That's why we filled it out before we came into the appointment. But did you find time to do that? No, you didn't. And I a lot of times will ask the doctor, haven't you looked at that yet? And they don't know what to say because they're caught off guard. No, they haven't looked at it. That's why they're asking you again. It's unbelievable. So and this happens to everybody. It doesn't just happen to me. This is what they're doing now. It's a total waste of time. Doctors, you got to listen to us. I have a different body and reactions than other people's bodies. You well know that. And just like pseudoephedrine, I have to take it. I went to the lung specialist. It's been a few months ago now. One of the first things I told him was, and this is down his alley because it's the breathing thing that the pill addresses. I told him, same thing. I said, I just have to tell you right up front, all doctors I see are like all against pseudoephedrine. I've been taking it for 35 plus years. I have asthma. I was born with a twin that had severe asthma, died at birth. And I was in the same egg. When I get panicked, my blood pressure goes up. When I take the pseudoephedrine, it drops in 10 minutes. It does not increase my blood pressure. I said, if I get a doctor that just will not hear that and understand that I'm different, possibly, but even the explanation in the pharmaceutical doesn't say it goes up. If you read it, it says it can go up. I said, if I don't get a doctor that agrees with that, the reason, the common sense of it, that when my body panics, my blood pressure goes up, but when I take it, I can breathe and now it drops, then I have to find a new doctor. He didn't like that. He didn't like that comment. And I wasn't being rude or anything. I was just being factual. If it's not who you are and you're dead set against pseudoephedrine, then there's no sense in me being here because I'm going to take it. It's the only thing in 40 plus years that I've found that works. I've taken all the others and they make me worse. I'm not doing them again. Okay? Like a gastro tried to force me to take these 3 medications. I reported the gastro to the medical board because I told them it caused me pain. And I said, you know what? I'm going to do it anyways. I'll show you I shouldn't have done it. But I knew I wasn't going to die from it. It's just, they don't agree with me. So then I reported them to the medical board. Forcing me to do something, I told them, caused me pain and didn't work. Doctors, stop doing it. Why do you have to do this? You got to be right. Well, her comment was, well, you just need to try it. No. I'm telling you, it doesn't work and it causes me pain. And why are you not hearing me? It's like arguing with a spouse. So doctors, you would really do yourself a favor here if you'd listen to your patients. You know that. Let me show you why. You're the patient now. I want to be in that room when that doctor's talking to you because you're going to be forcing the issue that you do what I'm talking about right now. That you're able to discuss with that doctor and tell him what you believe, what your side of it is. Yes, you're a doctor that went to school. That's not the issue here. The issue is what medications work for my body. You don't know me. I know that and can share it, and you guys, it's proven, do not look at our past records. You're not going to go through 50 years of records. So you are not aware of any of this. You need to open your ears and stop with the God complex that you know it all. This is what happened to one doctor when I had a heart attack. She kept my main provider. She kept pushing me, and she was getting irritated at me about all this pain also because she kept referring to other doctors, and they were all saying it couldn't be the heart. Guess who she was married to? Heart surgeon. And after I had a heart attack, I went back to her. And she stood there with a white face and wow, she was humiliated. She's married to a heart surgeon. But worse than that, if somebody says they have heart pain, anybody on the street that's not even a doctor would say, you should go to a heart doctor. You might be having a heart attack. Anybody knows that. But I had 10 doctors telling me it wasn't my heart because it was too much pain. How much stupidity is that? So what did I do? I didn't go to an emergency room, or I wasn't referred to a cardiologist or anything. This is insane. Absolutely insane. I went to the medical board with several of those doctors and reported them. This is unbelievable what we're going through out here, because you won't listen. I had one doctor say, well, I can give you shots, and if that's what you want me to do. That's what I want you to do? What, are you kidding me? Yeah, they get irritated and become smart alecks. I'm not telling you what's wrong with me. I'm telling you I have pain on the 15 on a 10 scale. They didn't like that, because 10 to them is, well, it can't be more than 10. No, it is more than 10. It's 15. I'm in a fetal position, and I have an extremely high pain threshold, and this is, when it comes on, it's from any kind of movement, picking up box, vacuuming. And I had this horrible pain that is, I can't take it. I'm in a fetal position, begging for this to go away. That's way past 10. So yes, there can be. They wouldn't listen to me. They let me have a heart attack. Luckily, it wasn't a fatal heart attack. So patience, people, open your mouth, be nice. Don't be forceful. I'm not. And I choose my words and just want to explain to them, this is what this does to me, and tell them why. If you give them a reason why that you know in your mind, it helps. Just like saying to them that when I can breathe better, my blood pressure drops. And I charted it. I charted it for a whole month. And that very first time. So I know it to be fact. Plus I can feel it. If you have heart issues, you know that when your blood pressure goes up, you start to feel different in your chest. You just do. It's like, oh man, it's not the pain. I'm not talking about pain. I'm talking about, it's just like, it's hard to describe, but there's a different feeling that you feel, and it's also in your head. Because of the hypertension, the blood pressure is the pressure is so much more intense in your blood, in your vessels, that you feel differently. So you know when it's up. You almost always know when it's up. And you know right away when you take the pseudoephedrine for me, and I can breathe now, it drops immediately. I mean, 10 minutes. It's down. I've done it in the emergency room and told them, and I had pseudoephedrine with me. I had to do it once, proved they wanted to give me morphine. Well, actually, they did give me morphine. So what did you do that for? That's not going to help me. It was due to pain from my teeth, which caused my blood pressure to go right through the roof. Doctors, you can have a much quicker session with your patients if you would listen to them. Ask them, is there anything you want to share about this medication? Have you taken it before? Ask them. You're not giving up your authority over them. You don't have authority over us anyways, but you act like you do. We have a choice of saying yes or no to you. And that's patience. You need to know that. You can say that doesn't work for me and refuse it, and do if it's problematic for you and you've taken it before. Doctors, you need to listen to patients. This needs to happen more and more and more. There possibly could be some people that survive because of this. And I would say there probably is. And I'm not putting that on you, doctors, their deaths. I'm just saying everybody, when they're more informed about something, is more successful. You well know that. So be more informed about your patient and let them be part of the process. I hate it when people say, yeah, you have to be your own advocate. I don't care about that term. I'm protecting my life. And if you don't want to listen to me, you might as well be somebody that has a gun in my face and you're going to pull the trigger. Because you just don't care about me. I could care less about the advocate label. You need to listen to me or I'm going somewhere else. It's that simple. And I'm not going to be that rude and say it like that to you. But that's the bottom line. Patients, don't be rude to the doctors. Just let them know. I've taken that before and be nice about it. Tell them why it didn't work. Tell them the problems that it caused you. They have to listen to you. If they don't, you go to a, you just walk out, say thank you. Don't cuss and don't do all that garbage. Just go to a different doctor. One reason why you don't want to do that is it will get around and actually get back to the insurance company. They actually have a capability of not providing you care. They do. It's in extreme circumstances. Otherwise, they can be reported to the the board, medical board, if they refuse your care. But if you're a problem, you become a problem in their system. And actually, the insurance company might say, we're not going to carry you anymore. They may even write you a letter and release you. That's what they do. Doctor can release you as a patient, so can the carrier. So just be decent. People are not being decent anymore. It's ridiculous. Just be decent. You're caring for your life, your very life. Doctors, understand, we know you don't know everything. The problem is, here's another problem. It's a major problem. It's the most major problem in healthcare. It goes to the practice. I don't understand, doctors, why you believe. Let me put it a different way. I would have a very difficult time being a doctor because what you have to deal with is diagnosing people with things that you have never, ever personally experienced. It's pretty tough sometimes. I know it is for you guys. I diagnose systems, and I have for 50 years. I can't verbally ask my system a question, but it's really equivalent. You need to know what's wrong happening. My system will act up and it pretty much lets me know what's going on. Problem getting descriptions from patients is everybody describes things differently. What does the noise sound like? Ee, but it actually sounds like t. They got it totally wrong. So the doctor is relying upon how you're describing what you're dealing with. And then, if he's never had it, he doesn't know what that pain feels like. He doesn't know what that rumbling in your chest feels like or sounds like in your mind. He doesn't know because he doesn't deal with it personally. Never has. So when you try to describe to them different conditions, it's really difficult for them to understand. Doctors, you got to listen to us. Because you've never had this before. How the heck can you even know what the heck I'm talking about if you don't listen to me? But you get, and I've had it many times. Nah, that's all right, you don't have to tell me. They don't have time. They don't care. They're going to just throw a drug at it and see if it works. Practice. BS, not with my body, you're not. You're not wasting my time. You know why? Because it's not going to go away. It's going to get worse, and it always does. And then I got to get another appointment, which can take a month. And now I'm going to have to go to the emergency room or urgent care because I can't, so that you're going to just push me off on them. Because that drug you gave me wasn't strong enough. That's the case with me right now. Because of this infection, and it caused my immune system to attack my whole body and caused RA, rheumatoid arthritis. I was in horrible shape because they had me on prednisone, Humira. It killed my immune system, made me autoimmune. I mean, it really screwed me up, this infection. Yep. Once the infection was gone, rheumatoid arthritis, everything was gone. It went away. It was because of the infection, which was in there for a few years. That white blood count was through the roof for a few years. Doctors kept saying, don't worry about it. People, if you have a problem in your mouth, you better look at it, because I almost died because of it, because of sepsis. It can get into your brain and in your bloodstream, and it got into my bloodstream. Almost killed me. They couldn't get it. They had 3 blood transfusions to pretty much wash out overcome that infection. And the sepsis antibiotics, these are extremely strong. Sepsis antibiotics, 2 sepsis weren't working. Doctor told me, he gave me the worst thing you could hear. He said, I don't know if we're going to be able to get a control of this, which meant you might die if we can't get control of this. It's exactly what that meant. I knew what it meant. I was like, oh my God, are you kidding? I'm 61 and this is it? Don't just trust they're going to make it all better. Sometimes it doesn't work out. That's where doctors have to listen to you also. You need to know your own body as well, and how you react to things. Pay attention, people. Don't just take it for granted that they know what they're doing. I'm not saying they don't, but every body is different. So you need to be part of the process. Doctors, allow us to do that. You are so rude when it comes to that. Almost every doctor, not all, are just in such a hurry to get out of the room. I said, hold on a second. I've got things I want to share with you, please. Like begging with them. And then they stop. They're not happy because they're behind schedule, because they overbooked. Force them to spend the time with you nicely. Okay? And doctors, you need to start treating us properly and listening to us. I know you're overbooked. Stop overbooking. That's your fault, not ours. And then you want to treat us terribly. This is really bad. I will change doctors if this happens, and I would ask other patients to do the same and teach these doctors a lesson. If they tell you if you're late, you have to reschedule, it's going to be another month, go find another doctor. They think we can sit in that office for 45 minutes, an hour and a half, 2 hours, and it's okay. Are you kidding me? If we're late, we're not missing anything. Because you ain't going to get to us for an hour and a half anyways. Or you got to pay if you cancel. Screw you, I got to pay if I cancel. If I cancel 5 minutes before, or even if I don't. You're not traveling to me. You're not taking resources to go to me. You're overbooked anyways. That's pressure off you, but you have one less patient to deal with and try to get out of the office that day because you overbooked yourself. So stop the abusive treatment towards patients. This is ridiculous. Patients don't put up with this anymore. There's no reason it has to be that way. They don't need to be charging us if we have an emergency. They get emergencies all the time. Do they pay us for leaving and not showing up at the office? And we show up there? No. It's all about them. No, it's not. We're the ones that get them paid. So we need to turn this around and start getting some decency from doctors' treatment towards patients again. This has gotten out of hand. We sit there and are very patient for an hour and a half, 2 hours which is ridiculous. When we make a scheduled appointment time, then they want to be abusive towards us. If we're late, we have to reschedule. No, I mean, some offices are terrible with this. I walked out at once, so I'll get another doctor, that's all right. I'm not dealing with this. And nobody should. Because we're not doing anything by being late 3 minutes. And it's like 3 or 5 minutes. If you're late more than 3 or 5 minutes, they have to reschedule. No, they don't. Because they're not going to get to you for an hour, hour and a half anyways. Because they're overbooked. So people stop allowing this treatment, this horrible treatment from doctors. It's a power trip is what it is. And start taking charge of that doctor and saying, I need to speak to you and let you know what I have to share with you, please. Please stop and allow me to do so. But be nice about it. Okay? We got to turn this around. I know doctors are having a difficult time with the payments and all that kind of stuff, and insurance, paying them properly. That's not our problem. We didn't pick to be in a practice. Okay? You're only practicing. If you're really doing real care, when you get done with practicing, maybe you'll get paid more. Okay? I know that was a terrible joke, but that's kind of how I feel. Because we're like guinea pigs out here sometimes. You just treat us like guinea pigs. Like we have no say in anything. And just take this, go, leave. I got another patient. Try it, see if it works. In a month, if it doesn't work, get back to me. That's not the way you do. That's not the way you do patient care. I'm sorry. Just not. Just throw something. It's like me throwing a part at an air conditioner and seeing, okay, lady, I know if you can't breathe tonight, you're going to die, but I'm going to throw a part at it because I don't have time. I got more calls to do. I'm just going to throw a part in there. I haven't diagnosed it properly or anything. Same thing. And it doesn't work and it kills her. It's the same thing, doctors, as you're doing. You're just throwing drugs at stuff. Like me throwing parts at the air conditioner and guessing. Listen to the patient and you might have more of a clue what's going on. I know you don't have the condition. Most conditions you deal with in diagnosing with patients, you've never probably personally had yourself. That's a big problem. It really is. Because you don't know how it feels. You don't know all the feelings that the patient's trying to describe to you. I understand that. That's why I said it'd be difficult for me. I got to do it all the time with my systems because they can't talk to me. Okay? I understand that. When my patient dies, I can bring it back. Yours dies, you can't bring it back. There's no reset. You got to get it right. So you need to be interacting with that patient even more so and listening to them. Patients don't put up with this abuse that we're getting. And I'm not saying it's all abuse from, but you got to be part of I don't like the advocacy. I don't like that word because to me it's not what it's totally about. You just need to be involved. You got to share your side while you're there. Make them listen. Okay? If they don't want to listen, don't be threatened. Just be nice and leave and get another doctor. You can either go on your insurance thing and choose a different doctor, PCP, or you can get a hold of the insurance company, call them and say, look, this doctor's not listening to me. I need you to help me find another primary care. Okay? Don't hesitate because you need the best care possible. And there's too many doctors out there who just don't care. Okay? And it's not about age, so don't go there. Some of the older doctors are actually better. Some of the younger doctors are better. It just differs. You do sometimes get the old crotchety ones that just don't want to work anymore. And they're just throwing stuff at it. And if you get that attitude, and just trust your gut, then go find another doctor. But, all right, so this is too long. It always is, but this is really important. If we start to work together, doctors, we can be more successful. And this won't be so much of a practice session, that you'll actually get more information from us to be able to better diagnose what really is going on, and get to the bottom line. And stop being so damn paranoid about people telling you things that aren't true. I know you get those people, but that's a small percentage of your patients. When I tell you this amoxicillin doesn't work, it's too weak, they don't want to listen to me. It doesn't work because I've been autoimmune because of the Humira and the infection that they let go so long, and I had to take Humira and prednisone, and those don't work. I have to take certain antibiotics. My body doesn't want to fight off infections now. And hopefully it will change and get back to a little bit better. But they have to listen to me or I'm going somewhere else. Because if they don't listen to me and they want to write amoxicillin or something, that's a waste of time. I'm going to be dead before I get another appointment to come back and get a different antibiotic, seriously. Or I have to go to the emergency room because it got worse and it turned into sepsis or something. I don't have time for that experimental, do what they say. If it doesn't work, we'll try something else. No, because that takes weeks or a month or so between changes. Patients don't understand that. By the time you get back and get a different drug, it's a month or so. Unless you go to emergency room or urgent care. And that's what you need to do, is go to urgent care right away if it's not working. 2 or 3 days, if you don't notice a difference with an antibiotic, you're going to notice something. It's going to be better. Loosening up phlegm, it's not tight and hard and sharp, but now it's loosening up and it's not sharp anymore. That's better. That kind of thing. There's some kind of change. It's better. You don't feel so dragged down. You're getting better. So the antibiotic's working. If you don't get that right away in 2 or 3 days, you got to react and get to urgent care and make your point to them. If you have an autoimmune situation like mine, tell them. And say it's in my records. And they have previous prescriptions, and 10 wasn't enough. I had to take 20. Look at the prescription, please. Look at the prescription. You'll see the last several are 20 of this antibiotic because the other ones aren't working. They'll write that script as long as they see proof of it. See, this is what you have to do because they won't believe you. They think you want something for, maybe you're going to sell it or something. Their mind goes somewhere else. I mean, they just don't want to listen. Plus, they're the doctor, and they're going to tell you what you're going to take. No, you're not. Not if you're not paying attention to my records. Okay? And I'm not trying to be disrespectful, doctors. Every doctor, good doctor, knows what I'm saying is true. And nurse, we have to stick up for ourselves because you don't have time to do it, and your people don't do it. You get our records, our history, the form you want us to fill out before we go to the appointment. But does anybody look it up? Does anybody look at our history? No. Nobody researches anything. And you do it again, the nurse assistant does it. And then the doctor does it. 3 times it's done for one appointment. And nobody's looking at it. Are you kidding? Wow. I mean, you talk about screwed up. 3 people have gotten the information, and you still don't listen to us either. And then you give us the wrong medication. In many cases. You guys got to start listening. And stop with the I know everything attitude. Because everybody is different. In most cases, you have never had this. So how would you know what it feels like? You don't. You don't. That's the real bottom line here, too. That's a really important factor. When you're trying to diagnose something, you're going by what they're saying, and people don't describe things right. They never do. Just like noises. I get that all the time in my business. So let's work together better, doctors and patients. But patients, stick up for yourself. You don't have to be rude and like these people are doing these days on airplanes and stuff. Don't do that. Okay, that's just going to get you thrown out of the practice or whatever. There's no reason for that anyways. But let them know that you want to be part of the process. I need to share with you, doctor, what's happening. I need you to hear what I'm saying because there's things that you aren't aware of. And spend the time and do it. Get to the point. At that point, they're going to get impatient. So get to the point. Don't drag on. Know that they are busy. So give them that as well. You know, explain it and get it over as quick as possible. They don't have all day with you. I understand that. But I need my time. It's like when I go to a home to work on something. I tell Texas when I train them, don't walk in there and step in front of the customer and say, no, that's all right, I know it. I'll check it out. I know what's going on. Don't do that. It's the same thing as a doctor. Ask. Here's one thing that everybody knows this. When you call or you take your car or whatever, and you want somebody to fix something for you, we all want to tell them our side of it. Everybody wants to do that. There's only very few that, and usually they're the snoots or the people that just don't know anything about the certain stuff. But most people want to give their side. I was doing this, explain what was happening, and because they want you to find the problem accurately. And they want you to know what's wrong and what they dealt with. Same thing with your body. We need time to tell you, doctor. Give us that time. We have to be part of that. Everybody needs to do that. Everybody. For everything we do in life is share their side. This is even more important because it's our life at stake. So this is even more critical than anything else we do, that we need to be part of this process. Stop not allowing us to do so and be in such a damn hurry, and stop overbooking your offices, appointments. Okay, so it's not my intention at all to tell doctors that they're not doing anything right. They're amazing. The one thing I don't understand is why, and this will never change, I'm the kind of person that has to know everything about something that I'm working on. Doctors, wow. If it's not in this part of your hand, and it's up here, it's a different doctor. Are you kidding me? It's 4 inches away. Yeah, it's amazing. I mean, I don't understand it. I mean, I would be frustrated as a doctor if I don't know what's going on 4 inches away from where I'm supposed to stop. I mean, are you kidding? I mean, I assume that a lot of them do know what's going on, but they're not the doctor that treats this part. He gets paid by the insurance company. It just makes zero sense. So you got them throwing you doctor after doctor after doctor. It's just insane. That's the other part of this. It's just garbage. Anyway, so, all right, I need to get going. You've heard enough. The bottom line is, let's just get some better care. And doctors, you and I and us patients, we can work this out to make it a better situation. Stop being abusive towards us about being late, or are you kidding me? 35 minutes late and you reschedule us, and doctor's appointments, they do that. Offices do that. I've had them do it. And I just changed doctor. I'm not dealing with that attitude. That's just abuse. I'm going to be sitting in here for an hour, and then you're going to turn around, I'm going to be 3 minutes late, and you're going to tell me I have to reschedule? Are you kidding me? Yeah. That's just garbage. That's just abuse. Doctor abuse. And these girls in the office, they're just rude when it comes to it. They're not going to listen to you. And I've had to go up higher and report these people. I won't tolerate it. I go up higher up and I report these people. I've gone to the medical board many times. Trying to stay alive in the last 5 years has been a chore. I had one heart surgeon almost kill me because he screwed up. And he lied to me. And then he came in an emergency room when I was there a couple of years later and recognized me. And how is he on my medical report? Why is he here? I told him to get out. He started yelling at me. I saved your life. I said, the hell you did? You almost killed me. And you lied to the hospital. You hid imaging and everything else. And you had somebody that you were teaching do the catheterization, and he did it in the wrong place. When I told you ahead of time, and you told me you were doing it, and promised it was only you, and you lied to me. Oh, this unbelievable what I've been through. I'm not going to go on and on about it, but this is why I'm the way I am now. I make sure that what you say is true, or I'm done with you, and I'm possibly going to report you if it's bad enough. And I've done it many times for these situations. But I'm definitely not going to be jeopardized by lack of proper care. It's just not going to happen. I want to stick around. So, all right. Once again, it's Michael Riley. And I'd love to hear other people's comments and situations and things that they've run into and whatever, anywhere this is posted, okay? Down, in the comments like normal. Okay, once again, it's Michael Riley, and take care and be a part of the process, but be nice, okay? Don't be rude about it. Don't be like the doctors or offices are, about being late and stuff. Be nice on our side, okay? We don't need any situations in doctors' offices. All right, take care. Once again, Michael Riley. Thank you. Bye-bye.